I asked earlier on the blood gas after CPAP therapy. Now, it is fortunate that the hypercapnia of this patient improved, although the hypoxemia is still persistent. So, that means that probably in time, with the continued use of positive airway pressure, the hypoxemia may also be relieved, no? Or the PaO2 of this patient may actually go back already to normal. But how do we know if the patient is adhering to CPAP therapy or not? It is easy for us to just ask the patient, but in most instances, even in real practice, the patient will tell you that he is putting on his CPAP therapy, even if in reality they do not. So what is important right now is for you to probably put in the memory card that you can already request from the supplier to be put as part of the positive airway pressure therapy. From there, you can take note of the number of hours that the patient is on CPAP. Okay, so good adherence will be if the patient uses CPAP for more than 4.5 hours, because studies have shown that more than 4.5 hours of treatment will give you improvement in oxygenation, improvement in hypercapnia, as well as improvement in the apnea events. So with that, thank you.
Thank you, Dr. Arlene. Our next reactor finished his Doctor of Medicine at FEU NRMF Institute of Medicine. He had his residency training in orthopedic surgery at Philippine Orthopedic Center. Furthermore, he pursued his spine clinical fellowship at InterHospital, Nagoya, Japan. He is an active consultant of the spine surgery unit at the Philippine Orthopedic Center. He is a fellow of the Philippine Spine Society as well as a fellow of the Philippine Orthopedic Society. May I call on Dr. Ferdinand R. Bernal.
Thank you very much for inviting me here. And I would also like to congratulate the presenter for a very nice discussion. So just to give you a background about scoliosis. Here is an x-ray of the spine, but it's not here because of the patient is too obese. So commonly scoliosis has three curvatures on the coronal plane: the proximal thoracic, the main thoracic, and the compensatory lumbar curve. So I measured the curvature of this patient. The proximal thoracic measures around 65 degrees. The main thoracic is around 115 degrees, and the compensatory lumbar curve is around 40 degrees. There is also a severe kyphosis of the sagittal view, but however, it's too difficult to see because the patient is too obese. Just an addition, scoliosis is a three-dimensional deformity. Besides the kyphosis and the scoliosis, there is also an axial component. This is the one that causes the rib hump. So as the thoracic vertebra twist or rotate, the corresponding ribs on that side becomes more prominent. That is what we see doing the forward bending test. So for this case, he has a severe rib hump on the right side. Aside from that, we can also note right side decompensation on the picture. So during surgery, I will describe to you what we are going to do if we're going to do surgery for this case. Unfortunately, we were not able to obtain a bending film. So we can more or less predict the possible correction, or we can assess the rigidity of the curve. So, for example, this case is a rigid curve. We might do an anterior release and followed by a posterior release. So we can do this in one sitting or a stage procedure. An additional information for those young patient with scoliosis who are just developing the curve, there's a coupled mechanism. As the spine, parang pagka nag-curve siya, nag-aano rin din, parang may coupled twisting. So, for young scoliotic patients, those curves still has the coupled mechanism, but as you age, it becomes structural. Even though you correct the curve, the twisted component is hard to correct because the structural changes already occurred. In our case is a 29-year-old male, so probably most of the structural changes have occurred in this patient. So you might ask me what is the benefit of doing surgery. It was mentioned by the presenter in one of the review of literature for those older than 20 years old. The pulmonary function after doing scoliosis surgery is not that good. Yes, I agree, because it will all depend on the amount of correction that we can achieve for this case. If this case is a young patient, we have done as severe as this one in our department. So we were able to have a good correction. But for this case, he is already a 29-year-old male with structural changes. I still don't know how much correction we can achieve. We still have to do some workups to predict the possible correction. So right now, if we are going to weigh the benefit and the risk, probably it will be too risky for our patient. So regarding the interconnection of obesity, scoliosis, and OSA, our case, he was diagnosed scoliosis since 8 years old. So probably it's a juvenile type of idiopathic scoliosis. For me, I think there's no interconnection between the scoliotic deformity, the OSA, and the obesity. Probably the OSA and the obesity came in a later time. So for me, my thoughts for this case is just to manage it medically first. If we are going to do surgery, we still have to prepare the patient really physically, because doing scoliosis surgery is really very extensive, and for this case, probably it will last around more than 10 hours surgery. So, thank you.
Thank you, Dr. Bernard. For our last but not the least reactor, she's a fellow of the Philippine Society of Endocrinology and Metabolism, as well as a fellow of the Philippine College of Physicians. She finished her Doctor of Medicine at FEU NRMF Institute of Medicine and later pursued her residency training in internal medicine at the same institution. She had her fellowship in endocrinology, diabetes, and metabolism at the University of the Philippines, Philippine General Hospital. Friends and colleagues, let us welcome Dr. Myla Verastige Custodio.
Good evening. I'd like to congratulate our presenter for a very well-prepared presentation. So for this, for tonight, I was given the task to present, to discuss metabolic syndrome, particularly the management of obesity. And this is my goal for tonight, to make it simple. So our patient fulfill the criteria of metabolic syndrome. And in the Philippines, metabolic syndrome, so our patient fulfill the criteria of metabolic syndrome. And central to this is the obesity. It's not it is not just obesity, but visceral adiposity. So meaning it is because the adipose tissue is the one that produces cytokines that leads to the development of the other criteria of the metabolic syndrome. And in the Philippines, obesity or the incidence of obesity is 4.9% in 2003. So meaning by this time it's more than that. It's not just BMI which should be looked upon, but also the waist circumference. Because association of BMI and waist circumference, as you increase BMI and waist circumference, you also increase the associated disease risks such as type 2 diabetes, cardiovascular disease, and hypertension. And what are we going to do? So in our patient, option number 1 is not possible because of the other comorbidities that are already present. What is our goal? So weight loss of approximately 10% from the baseline. So ganun lang kababa. And the target date is 6 months. So to achieve the goal, you just have to less your total caloric intake by 500 to 1,000 kilocalories per day, and that will translate to 1 to 2 pounds weight loss per week, equals to 10% weight loss in 6 months. And that will be achieved by low caloric diet with reduction in saturated fats. So we need to decrease the saturated fats in order also to decrease the triglycerides and address the cholesterol problem of this patient. And we also need to increase physical activity, and that is a moderate intensity exercise 30 to 60 minutes per day, 5 to 7 days a week. So I'm always telling my patient the first line of treatment for obesity, diabetes, is free diet and exercise. Hindi mo kailangan magbayad. Combination of diet, behavioral therapy, exercise is very important in the treatment of obesity. And if this fails, there are pharmacological therapy that is available. And in the Philippines, sadly, it is only orlistat. In the United States, last year they already approved lorcaserin and phentermine pyramide on the management of obesity. And since obesity is already considered a disease, we can expect addition to this management. How about surgical management? So if your diet, exercise, and pharmacological therapy fails, you can try bariatric surgery, which definitely can decrease the weight. So if I will be asked by Dr. Lucas Uy if I'm going to advise surgery, first I'm going to ask the presenters, how is the patient now? Meron na bang 10% weight loss? 6 months, naka 6 months na ba sila in treating the patient, the obesity of the patient? So, and did they already added pharmacologic therapy? So, pag meron ng tatlo and achieve the weight of the patient still the same, probably if the only problem is obesity, yes, surgical management can help. It can help. But considering the other comorbidities of the patient, baka hindi siya makalabas sa operating room. So, I don't know. So, thank you very much. So, the next time you eat, think of your weight think of your health. Thank you.
Thank you, Dr. Amala. That is in time for our dinner later.
Wala nang gagawin.
Okay. Do you have any clarifications or questions to our actors? If there are none, I would like to call back our 4 actors to please receive our token of appreciation. Thank you so much for attending our case presentation. Dr. Malikse, Dr. Limpin, Dr. Bernal, and Dr. Custodio. Please come in front. I would also like to call on Dr. Fernando Ayuyao, Dr. Ligia, Dr. Manzon, to please give our tokens of appreciation. We'd also like to acknowledge the presence of Dr. John Clifford Aranas and his fellow for coming all the way from Perpetual Super Hospital in Philippine. And also, Dr. Odrunya, who just came back from the United States, and Dr. Lucas Lee. This is indeed a very fruitful evening, and at the same time, it left us a challenge in facing a very complicated and unlikely case like ours. Hopefully, in the future, we'll be able to coin a new term for this syndrome. To end and to give his closing remarks, may I call on the Vice President of the Philippine College of Chest Physicians, Dr. Chad Ray Karumi.
Thank you very much. On behalf of the CCP, I would like to congratulate the training committee, especially our chair for Section of Pulmonary and Heart Center, Dr. Yuyao, and our Emeritus, Dr. Lidia. So I guess everybody is proud of their fellows and their presentation, and I believe Dr. Limpin was not exaggerating when she mentioned that this is how you present a particular case, no? Not only by history but well as the dynamics of the interaction of the fellows. And I guess she was not exaggerating also that when I say Tatak Heart Center, you know the history of Heart Center when they do presentations, not only for the quality but also for the substance. No? And of course they have won several times. And when I was coming here, I was thinking, meron ba tayong Hall of Famer, no? Kasi you always get the awards every time. Eh? Yun nga, Hall of Famer, maybe we can do that particular point. Now, yes, you have to present also. Before I make some announcements, again, when I was coming here, and I heard the song, William actually song, and then I think everybody knows the song, but actually it made me tearful because I was a 9-year-old boy when I saw the Heart Center hymn. I was here as a 9-year-old boy. I was in grade 5 when the Heart Center was inaugurated by then President and First Lady Marcos. So again, it brought tears to my eyes. And seeing the fellows I have worked with and I have served under the past presidents, I'm really very happy to be here. So again, that's just to show you how old I am now. So some announcements. This one will interest you. The research travel grant was raised to $200 for those who are interested, fellows in training, to present a paper, oral or poster, in any international convention. Screened and approved by the PCCP Research Committee. Again, it will be a maximum of 3 requests per institution. Before, it used to be $150. We increased it to $200. Before, it used to be just 2 fellows presenting under 1 institution. Now it's 3. And of course, it has to be coursed through the PCCP Research Committee. That's a good, I think it's a welcome sign, and then we'll try to fund more for research. Again, an announcement, our chair for the PCCP Regional Convention, Dr. Biseto, will actually be angry if we don't announce the upcoming media convention within this month. Everybody knows about this one. No? The mid-year Pulmonary X Factor will be held at the Grand Caprice. This is CBO, Cagayan de Oro, from July 26 to 27. And for the fellows, I urge you to come a day before. It will be July 25 when we have our InterHospital debate. It will be at 6 p.m. at Mulberry Suites. Okay, so I encourage all the fellows to come early, and then of course the convention will end on a Saturday. The next InterHospital Symposium will be hosted by Perpetual Succour Hospital on August 30 at the GSK Zeta building. I think why Dr. Jan is here. And he brought along his fellows, actually will be presenting for the first time, and a very high standard to meet, coming from the Heart Center. Now, again, another good news for the fellows. 18th Congress of APSR 2013 will be held from November 11 to 14 at the Conference Center, Pacifico, Yokohama, Japan. So that's one good news. No? It will be near. It will be held earlier than last year. December was last year. And the deadline for abstract will be July 15, 2013. Again, this is the best news. No? The Congress registration fee will be waived for the pulmonary fellows in training. Okay? So that's a good news for us. No? Of course, the plane fare and the stay will be more expensive. Sabi nga rin Dr. Lee, our Congress for 2010 APSR, she knows about this. Of course, she's a governor for that. So the announcements were made, and I'd like to thank again the Heart Center for holding a very fruitful and very educational presentation as always. I'd like to thank the training committee, and I'm glad to see graduates from outside, from out of the country or here. So I would like to thank them for coming here, and I'm sure that you're very happy with them coming here and visiting you. So again, thank you very much, and then we close our InterHospital Symposium for today. Of course, we will mind the food that we eat, but whenever we look at what disease, we'll try to digest it as much as possible. Thank you very much, and good evening.
The Philippine Foundation for Lung Health Research and Development, in cooperation with the Division of Pulmonary and Critical Care Medicine, would also like to invite you for their upcoming biennial symposium on September 18, 19, and 20 at the Crown Plaza. Dinner is served. Bon appetit, everyone.
Yung ballpen. Yung ballpen. Basically, maraming kakwento.
Thanks,
Pasok mo na. Pinigay mo pag gano'n ha. Ano yung ano nito? Candy. Kapalit sila? Okay, thank you. Hindi mo din yung ano. Yung picture yung camera. Alam ko tapos na eh.
Ano kasi ako sa USD? Ha? Ihina ako sa sakto. Hindi kasi na baka nalampasan na ako.